Hello, I'm Jerri Jackson of the Managed Care Division here at the Alabama Medicaid Agency. I'm here today to provide a presentation to the PMPs regarding completing the Patient First enrollment application. And we'll go ahead and start our presentation. We're going to be going over the Patient First application instruction and common mistakes that we're seeing being made now as the PMPs fill out this enrollment application, and to assist you in not making these same mistakes. We'll also give you Patient First information and contact information. In order to assist the Patient First enrollment process, HP and Alabama Medicaid are offering webinars for outreach and questions. Our goal is to make sure we have a seamless transition to the statewide expansion of our Health Home program. Health Home statewide expansion. As you know, the Health Home program will be statewide effective April 1, 2015. This is new for Alabama Medicaid. Previously, we only covered 4 areas of the state. Now we are going statewide and will be covering all counties in the state. The probationary RCOs will be managing the Health Home programs, and they will be doing this under Medicaid supervision. In order to prepare for the statewide expansion, providers must complete a Patient First enrollment application, and as well as they must have a signed contract with the probationary RCOs, and these both must be completed by March 1st, 2015, and to Medicaid. The RCO will send the contract to Medicaid, and the PMP must send the Patient First agreement to HP. If this complete information is not received by March 1st, 2015, your case management payments for the following month could be delayed. Providers must enroll individually in Patient First. This will be new to the providers now that are enrolled as groups. This will especially affect the FQHCs and the RHCs and other providers that are enrolled currently as groups. All physicians currently enrolled in Patient First groups must enroll with Medicaid as individual Patient First providers. Recipients that are assigned to individual Patient First NPIs only and will no longer be assigned to a group number. Currently, all the patients that are assigned to groups now are only assigned to that group number, and they're not assigned to individual PMPs within that group. Now they will be. If a provider is currently enrolled as a group, assignments will be made to participating Patient First providers within that group. You are able to also receive assistance from HP in helping you make that assignment. You may also contact LaTonda Cunningham or Gloria Wright with our Patient First program, and they will be happy to assist you in making those changes. The individual Patient First enrollment form may be accessed on Medicaid's website. You will need to go down to the link at the bottom of the page. It's in green. When you click that, you will come to our enrollment forms. You need to scroll down to the bottom of the page, and you will see a new Patient First, individual Patient First enrollment form, as well as a letter that has gone out to all PMPs. And you will be able to read that letter and run off a copy of the agreement form. At the same time, Medicaid has mailed a copy of the letter and with a packet that includes the enrollment application to each PMP within the state. The Patient First enrollment application key points. These are points that currently our provider enrollment at HP have found to be an issue. The first one is the description of the 24/7 coverage. If you are using a hospital for your 24/7 coverage, a copy of the agreement with the hospital or a letter on that hospital letterhead must be submitted with that patient first agreement. Refer to page 13 under brief description of your arrangements for 24/7 coverage. If you are using an answering service for your agreement, the name and the phone number of that answering service must be listed on the patient first agreement in attachment A on pages 12 and 13. Page 13 is where you put the phone number and the name. Description of admitting privileges. If another physician or group is providing admitting privileges, the physician performing the admitting privilege services must sign page 15 of the agreement. One of the things that we are finding to be a problem is the ages admitted, the age group on page 15 does not match the current PNP's assignment. And let me give you an example of that. The current PNP may be enrolled to cover 0 to 99, make sure, or 0 to 18. Make sure that the person covering for you can cover the same age group. We're having problems with that. Key points on the patient first agreement, other key points. The mid-level extenders, the nurse practitioners, and physician assistants must have a collaborating physician. When HP is looking at this, they are looking up to make sure that that nurse practitioner or physician assistant does have a collaborator. Only 2 extenders are allowed per physician. Please submit all individual agreements for one office in a single mailing. This process will facilitate the transition of the recipient assignment to individual providers. This really helps our HP enrollment staff to be able to complete that application without a break. Otherwise, if another provider comes in at a different time, she has to make sure that they're linked up to that group number. On page 3 of the agreement under EPSDT, if you're currently enrolled in the EPSDT program and have a CLIA certificate on file, then no additional information will be required. All you have to do is check yes on page 3. Key points related to the Health Home program. All patient first providers should use their individual NPI number on all referrals beginning April 1, 2015. Referrals made with the patient first group NPI will continue to be honored until the referral expires or through March 31st, 2016. All cascading referrals should identify the NPI number and the name of the recipient's PNP beginning on April 1st, 2015. This is extremely important so that the specialist that the referral is going to ties back to that PNP. Key points on office referrals. Are you a patient first physician that has a CRNP or a PA assisting with your patient caseload? All PAs and CRNPs must use the individual's NPI number and name for referrals outside of the group practice. This is important to tie everything back to that patient first doctor. PAs and all PAs and CRNPs within the group practice must use the individual PNP's NPI number as the referring provider on their claims. If you are a PNP within that group practice, you do not have to do the same if another PNP within the practice is out that day and you're seeing that that physician's patients. A written referral from an individual PMP within a group practice is not required. Will a written referral be needed when an enrolled patient-first provider within a group treats a patient assigned to another provider within the group? As I just said, a written patient-first referral will not need to be completed when an enrolled PMP treats a patient that's assigned to another provider within that group practice. I do want to go back and reiterate that for PAs and CRNPs, on their claims that that PMP will need to be listed on the claim, but a written referral will not need to be done as long as it's done within the group practice. Contact information: you may contact provider enrollment at any time on the number listed. You may also contact our Provider Assistance Center and Patient First with any Patient First program with any policy questions. LaTonda Cunningham or Gloria Wright will be glad to assist you. Also, we've listed our HP representatives, and you may call them with any questions.